Hi, so for my project, I chose fibrodysplasia ossificans progressiva, if I said that right. And the reason I chose this topic is because I've seen videos and stories of those who suffer with this disease online and have always found it very interesting. I also work on an orthopedic surgery floor at the Marshfield Medical Center, and I find abnormal bone conditions to be very interesting. And a little bit about the disease. So, fibrodysplasia ossificans progressiva, or FOP, is an extremely rare genetic connective tissue disorder characterized by the abnormal development of bone in areas of the body where bone is not typically present, such as the ligaments, tendons, and skeletal muscles. This disorder causes the body's skeletal muscles and soft connective tissues to undergo a transformation into bone, progressively locking joints in place and making movement difficult or impossible. This contrasts with normal anatomy, where the tissues remain soft and flexible, allowing for movement and other bodily functions. FOP is a progressive condition where the skeleton grows and stiffens over time, restricting joint mobility and making movements increasingly difficult. And then there's a picture right there of like up here is the normal muscle and normal skeleton, and then here's how it becomes kind of conjoined and grows together over time with FOP. And then most cases of FOP occur sporadically, and there is a single affected individual within a family. When a familiar pattern has been identified, FOP is inherited in an autosomal dominant pattern, although that's not typically common because usually they don't have children, the people who have this disease. In 2006, researchers at the University of Pennsylvania, Eileen M. Shore, PhD, and Frederick Kaplan, PhD, published results of research identifying the genetic cause for FOP. The team found that FOP is caused by a variant in the ACVR1 gene in the bone morphogenic protein signaling pathway, and bone morphogenic proteins are regulatory proteins important in embryonic skeletal formation and in postnatal repair of the skeleton. The ACVR1 encodes a BMP receptor called activin receptor IA, or ACVR1, one of 4 known BMP1 receptors. BMP receptors are located on the cell's surface, and they help determine the fate of stem cells, in which they are expressed by transmitting signals into the cell. The classic clinical FOP presentation is caused by the specific substitution of a particular amino acid, which is arginine, at position 206 in the ACVR1 for another amino acid, histidine. And then this amino acid substitution induces activation of signaling by the ACVR1 receptor. So that's kind of like the normal physiology of it and how it normally works. And then it goes and shows the mutation. And so, So for some of the signs and symptoms, diagnosis of FOP begins with a physical examination that identifies the symptoms of the condition, along with a genetic test for the mutated ACVR1 gene. Imaging tests such as x-rays are also beneficial in examining the progression of the disease and new bone growth over muscle and connective tissue. The first clinical symptoms of FOP are malformations of the toes, which are present at birth. The skeletal malformation is typipally a shortened great toe with a malformed distal first metatarsal and a missing or abnormal first phalanx or interphalangeal joint. Other malformations typically present at birth include inward turning of the toes and fingers, malformations of the upper part of the spinal column, and an abnormally short, broad neck of the femur. Progressive bone formation in connective tissue, otherwise known as heterotrophic ossification, usually occurs during childhood and progresses throughout life. Abnormal development of bone may occur spontaneously, but often follows an episode of soft tissue injury or viral infection. The first sign of heterotrophic ossification is swelling in the affected area, typically in the back, neck, and shoulders. These soft tissue swellings mature through a cartilage to bone pathway or endochondral mitochondrial pathway to form mature heterotrophic bone. This abnormal development of bone eventually leads to painful stiffness, limited movement, and potentially complete immobility. If the jaw is infected, the person may have trouble eating or speaking. As mobility begins to deteriorate, affected individuals have an increased susceptibility to respiratory infection or right-sided congestive heart failure due to thoracic insufficiency. And so then here is the toes of a person when they're born, which is kind of the first sign. And that's like the spine and back when they're a baby compared to probably around the teen years. And then for the prevalence, treatment, and prognosis, although severe, FOP is an extremely rare disorder believed to occur in approximately 1 in 1 million people worldwide, and it affects all races/genders equally. Although autosomal dominant, most cases of FOP result from new variants in the gene. These cases occur in people with no history of the disorder in their family, and testing is typically not done prior to birth. Although there is no cure for FOP, treatment aims to reduce symptoms, especially flare-ups that cause the bone growing process. Treatment for FOP is typically unique to each individual to address their specific symptoms. These treatment options can include occupational therapy to improve physical needs, preventative antibiotic therapy to avoid respiratory infections, and then medications to reduce swelling and pain associated with flare-ups, such as corticosteroids, non-steroidal anti-inflammatory medication, and muscle relaxants. And another treatment option is mobility equipment to help them get around. The prognosis for FOP is quite poor due to the severe symptoms of the condition, and life expectancy for FOP is only until early adulthood. By age 30, most people are completely immobile, and the leading cause of death for those with FOP are respiratory infections. In addition, although no cure has been found, there are active clinical trials aiming to increase the lifespan of those with FOP by introducing new medications and treatments. And then I did include a video. I'm not going to play it, but it is quite interesting. It's just about a woman who has lived with this for her whole life and what it's like. And then last are my references.